Hello everyone, welcome to my channel. So today's my topic is personality disorder. So it is a topic of psychology, third year in nursing. So mainly personality disorders are divided into three clusters: cluster A, cluster B, and cluster C. In this video we are going to discuss about these two clusters. So in cluster A, it is further divided into three types: paranoid, schizoid, and schizotypal personality disorder. So before discussing about these types, we are going to discuss about the definition of the personality disorder. So mainly the definition of this personality disorder, in this the person with personality disorders is mainly having failure to identify self and mainly failure to develop the interpersonal relationship with others, and mainly the person with this personality disorders is having a deeply maladaptive behaviors and unable to maintain the social relationships also, and it may recognize from adolescence earlier and continue enough most of adult life through most of adult life. So it's all about the definition. Then come to mainly on types. So our first type is a paranoid personality disorder, as we discussed before. Paranoid personality disorder in cluster 1. So mainly the paranoid personality disorder is characterized by a distrust or a mistrust. The patient or a person with this personality disorder having issues regarding loyalty, doubt regarding the commitments, and mainly having a mistrust between the relationships, or peoples are mostly suspicious, and having they mostly think that the other people's having a sinister motive regarding his or her, or they are mostly search hidden meanings of the other people talks. So these are the main characteristics, and sign and symptoms are: these personality peoples are mostly suspicious, mistrust, sensitive, argumentative, stubborn, self-important, hypertensive, and jealous and irritable. Then next is a schizoid personality disorder. In this type of disorder, the patient is mainly detached and socially withdrawed, because these type of personality disorder peoples are mainly unable to react appropriate on the very important events of their life. So they are mainly having no friends, no close friends. They stay away, aloof from even their family members also, as they are commonly described as loners, because they likely to stay alone as according to their personality disorder. And their sign and symptoms are: they are like emotionally cold, aloof, detached, humorless, introspective, and they having a no desire to enjoyment because they like to stay aloof. They didn't make an appropriate social relationship with others and unable to experience pleasure because they are not likely to make any relationships or close friendships, and don't ever mix up with their family members also. So then next is a schizotypal disorder, personality disorder. In this type of personality disorder, the person is mainly characterized by their odd thinking, odd behavior, or this type of personality disorder peoples mainly do daydreamings, make their own fantasies, and due to their daydreaming and fantasies, they are unable to make an appropriate relationships with their friends, with their family members. And there's sign and symptoms: they're having inappropriate affect, odd beliefs, magical thinking, socially withdrawal, okay, odd behaviors, lack of social relationships, social isolation, and not fitted easily into the others just because of their odd and dreamy behavior. Then last one is a antisocial personality disorder. As its name is clear enough, antisocial means the person can do the things which is not accept in our socially unacceptable, and mainly it is characterized by a chronic antisocial behavior that violates other rights, or for example, if we can consider that a group of persons hanging out at the side of the street, or disregard others, is also considered as an example of the antisocial behavior. So mainly the sign and symptoms are failure to sustain relationship. Just because of antisocial relationship, the person is unable to maintain the proper relationship even with their family members or neighbors. Disregard others' feelings, impulsive actions, low tolerance power, okay, and lack of guilt. Whatever they are doing wrong, disrespecting others, but they don't have any type of guilt. And tendency to cause violence, failure to learn from their experiences, reckless driving, you can say, and disregards for own or others' safety, manipulative behaviors, and inability to maintain a close personal sexual relationships just because of their antisocial behavior. Also, you can say as a criminal behavior. So that's it with our cluster A. So in next video we are going to discuss about the cluster B. Thank you.